Why are aneurysms known for being silent killers? This is our topic for today's video. Stay tuned to learn more about aneurysms, prevention, signs, symptoms, and more. Arteries are blood vessels that carry oxygen-rich blood away from the heart to the rest of the body. They have three layers. Intima, the innermost layer, which is a smooth, thin lining. Media, the middle layer, composed of elastic and muscle tissue that helps the artery withstand pressure from blood flow. Adventitia, the outer layer, providing additional support and structure to the artery. Healthy arteries are flexible and strong, enabling them to handle the high pressure exerted by blood flow. What is an aneurysm? An aneurysm is an abnormal bulging or ballooning in the wall of an artery. This occurs when the artery wall weakens and stretches beyond its normal limits. Aneurysms can develop in any artery, but they most commonly occur in the aorta, which is the main artery from the heart, in the brain, the legs, and the spleen. How do aneurysms form? Aneurysms form when the arterial wall becomes weakened. Several factors contribute to this weakening, including chronic inflammation, constant inflammatory stimulus against the body, high blood pressure. Continuous high pressure against the artery wall can cause it to weaken and bulge. Atherosclerosis. Build-up of plaque in the arteries can erode the wall and create weak spots. Genetic conditions. Disorders like Marfan syndrome and Ehlers-Danlos syndrome affect connective tissue and can predispose individuals to aneurysms. Infection. Infections in the artery wall, or mycotic aneurysms, can lead to weakening and aneurysm formation. Trauma. Physical injury to an artery can cause damage and subsequent aneurysm. What are the most common aneurysms? There are several types of aneurysms, but the most common are aortic aneurysms. Occurring in the aorta, these can be thoracic, located in the chest, or abdominal, found in the abdomen. Cerebral aneurysms. Found in the brain, these are often called berry aneurysms due to their shape. Peripheral aneurysms. Occurring in arteries other than the aorta and brain, such as the popliteal artery behind the knee or the femoral artery in the thigh. Splenic aneurysms. Found in the artery that supplies the spleen. What is the danger of having aneurysms? Aneurysms pose significant health risks, primarily because they can rupture, leading to life-threatening internal bleeding. These dangers include rupture. When an aneurysm bursts, it causes severe internal bleeding. A ruptured aortic aneurysm, for instance, can lead to death within few minutes without emergency medical intervention. Dissection. This occurs when the layers of the artery wall separate, allowing blood to flow between them, which can lead to rupture. Compression of nearby structures. Large aneurysms can press on nearby organs or nerves, causing pain and functional impairments. Why are aneurysms known as silent killers? Aneurysms are often referred to as silent killers because they typically grow slowly without any symptoms until they become large or rupture. This asymptomatic nature makes them difficult to detect early. Many people are unaware they have an aneurysm until it's discovered incidentally through imaging tests for other conditions or when a catastrophic event, such as rupture, occurs. What are the signs and symptoms of aneurysms? While many aneurysms remain asymptomatic, certain signs and symptoms can indicate their presence. Aortic aneurysms may cause back pain, a pulsating feeling near the navel. This may indicate an abdominal aneurysm, or chest pain also may be an indicative of a thoracic aneurysm. Cerebral aneurysms can lead to a sudden, severe headache, vision problems, pain above or behind the eye, and neurological deficits like weakness or numbness. Peripheral aneurysms might cause a pulsating lump, pain, or impaired blood flow to the limbs. Splenic aneurysms, often asymptomatic, but can cause abdominal pain or shoulder pain. How to prevent aneurysms? Preventing aneurysms involves managing risk factors and maintaining optimal vascular health. You can make improvements in the next areas. Control blood pressure. Regularly monitor and manage blood pressure through lifestyle changes and medication if necessary. Healthy food plan. Eat a balanced diet high in potassium, low in trans fats, and sodium to reduce the risk of atherosclerosis. Regular exercise. Engage in physical activity to maintain cardiovascular health and reduce hypertension. Stop smoking. Smoking is a significant risk factor for aneurysms, so quitting is crucial. Monitor cholesterol levels. Keep cholesterol levels in check with a heart-healthy diet and medications if needed. Regular checkups. especially if you have a family history of aneurysms or related conditions. What to do when you have an aneurysm. If diagnosed with an aneurysm, follow your doctor's recommendations. We also have some tips you can also apply. Regular monitoring. Small, asymptomatic aneurysms are often monitored with regular imaging tests to track growth. Medication. Blood pressure lowering medications and statins may be prescribed to reduce the risk of aneurysm expansion and rupture. Lifestyle changes. Adopt heart-healthy habits, including a healthy food plan and exercise modifications. Surgical intervention. Large or symptomatic aneurysms may require surgical repair, either through open surgery or less invasive endovascular techniques. What are the signs of alert? Immediate medical attention is necessary if you experience symptoms suggesting an aneurysm rupture or dissection, sudden severe pain. Intense pain in the chest, abdomen, or back, often described as tearing or ripping. Loss of consciousness. Fainting or sudden collapse can indicate severe internal bleeding. Signs of stroke. Sudden headache, vision changes, weakness or numbness on one side of the body, difficulty speaking or understanding speech. Shock symptoms. Rapid heartbeat, cold, sweating, dizziness, and low blood pressure indicating internal bleeding. Understanding aneurysms, their risks, and preventive measures can save lives. Stay informed, monitor your health, and consult healthcare professionals regularly to manage your risk factors effectively. In conclusion and to summarize today's video, aneurysms, often dubbed the silent killers, represent a significant and often hidden threat to our health. By understanding the anatomy of arteries and the nature of aneurysms, we can better appreciate the risks they pose and the importance of early detection and prevention. Arteries, the vessels that transport oxygen-rich blood from the heart to the body, are comprised of 3 layers. The intima or inner lining, media or muscular middle layer, and adventitia or outer layer. These layers provide strength and flexibility to withstand the constant pressure of blood flow. However, when these walls weaken due to factors such as high blood pressure, atherosclerosis, genetic conditions, infections, or trauma, aneurysms can form. This bulging or ballooning of the artery wall poses a serious risk if it continues to expand unchecked. The most common aneurysms include aortic aneurysms, thoracic and abdominal, cerebral aneurysms, peripheral aneurysms, and splenic aneurysms. Each type has distinct risks but shares the potential for rupture, leading to severe internal bleeding, which can be fatal if not promptly treated. Aneurysms can also cause complications by compressing nearby structures, resulting in pain and impaired function. Aneurysms earn their moniker, silent killers, because they often develop and grow without noticeable symptoms. This asymptomatic nature means many individuals remain unaware of their condition until a catastrophic event, such as a rupture, occurs. When symptoms do present, they vary based on the aneurysm's location, potentially including severe headaches, vision problems, chest or back pain, pulsating sensations, or neurological deficits. Preventing aneurysms centers on managing risk factors through a healthy lifestyle. Key preventative measures include controlling blood pressure, maintaining a balanced diet, engaging in regular exercise, avoiding smoking, and monitoring cholesterol levels. Regular checkups, particularly for those with a family history of aneurysms, are crucial for early detection and management. For those who are diagnosed with an aneurysm, careful monitoring and lifestyle changes are essential. Medications to control blood pressure and cholesterol may be prescribed, while regular imaging tests track aneurysm growth. In cases where the aneurysm is large or symptomatic, surgical interventions may be necessary to prevent rupture. Recognizing the signs of an impending aneurysm rupture or dissection is vital for timely medical intervention. Symptoms such as sudden severe pain, loss of consciousness, stroke-like signs, or shock symptoms require immediate emergency care. Understanding these warning signs and acting promptly can significantly increase the chances of survival and recovery. So, aneurysms pose a serious, often hidden threat that requires awareness, prevention, and proactive management. By understanding their formation, risks, and symptoms, and by adopting healthy lifestyle habits, we can mitigate the dangers they present and protect our cardiovascular health. Thank you for tuning in to Levitas. If you found this video helpful and informative, please be sure to share it with your friends and family, give it a thumbs up, subscribe to our channel, and hit the bell icon to receive notifications for future videos on weight loss, health, and fitness content. Also, leave a comment sharing your questions, thoughts, and experiences with today's subject. We love hearing from you. Your support is very appreciated. It helps us grow and create even more content for empowering you to achieve a better body and optimal health every week. Remember to fuel your body with the right nutrients, stay consistent with your training, and keep striving for your fitness goals. Until next time, remain tuned to Levitas for more expert advice to help you on your health and fitness journey. So, stay healthy, stay happy, and keep going.